Hello guys, this is Vamshi Krishna. Today we'll see some of the basic questions for upcoming staff nurse recruitment examination. So the first question is, the vaccination was firstly performed by. Options are Jonas Salk, Edward Jenner, Louis Pasteur and Alexander Fleming. The right person is Edward Jenner. So he is the first person who has started the giving vaccination for the human being. That is Edward Jenner, and Louis Pasteur is the person who has developed the vaccine. The next one is, all vaccines are stored at PHC. Options are deep freezers, Iceland refrigerators, walk-in cold room, cold boxes. The right option is option B, Iceland refrigerators in the PHC center. So, in the regional level, the vaccines are stored in the walk in cold room with the temperature of plus 2 to 8 degrees centigrade and walk in freezers minus 20 to 40 degrees centigrade. And the community health center is large Iceland refrigerator, that is plus 2 8 degrees centigrade, and large deep freezers, that is 20 to 40 degrees centigrade temperature. And finally, the PHC level, the small Iceland refrigerator with plus 2 to 8 degrees centigrade and a small deep freezer, that is minus 20 to 40 degrees centigrade. The next question is, global immunization program was started in the year of. Options are 1870, 1974, 1978, 1985. The right one is the 1974. The global immunization program was started. UPI, Universal Immunization Program in India. Options are 1978, 1965, 1990, 1985. The right one is the option D, 1985. UPI is started in the India. The next one is the rotavirus administered dose in which route. So in this question we have the two questions. Okay, answer correctly. Options are orally 5 drops, intramuscular 0.5 mg, subcutaneous 0.10 mg, orally 10 drops. The right one is a orally 5 drops. So rotavirus has given by orally and the dose is 5 drops. The next one is identify the condition and with the type of defect. So here you are seeing the picture of a baby has the neural tube defect. Okay, so which type of is this? Option A, spinal cord injury. Option B, spina bifida meningomyocele. Option C, myocele. And option D, spina bifida occulta. So these are the spinal cord injuries. The right one is the option B, spina bifida meningomyocele is the type of neural tube defect. The next one is ideal temperature for polio vaccine. Options are minus 10 degrees centigrade, minus 20 degrees centigrade, minus 5 degrees centigrade, plus 1 degree centigrade. The right one is a minus 20 degrees centigrade. The polio vaccine can be stored. The next one is most cold sensitive vaccine is. Options are DPT, OPV, MMR and Rota. The right one is the DPT. So DPT is the highly cold sensitive vaccine. When it is freezed, it should be discarded in the dustbin. It cannot be used when the DPT vaccine is freezed. The next one is repeating the words, the response of a question by a child. Okay, when we ask the question for a child, when he is doing the repeating the same words towards the question. Options are tongue anxiety and autism, word salad, perseveration. The right option is option D, Perseveration. Perseveration is the right answer. This is unrelated, repeating the same words towards the question. That is perseveration. And tangentiality is the unnecessary words repeating. Word salad is the all words in the one answer. He is repeating the he is saying the unnecessary and unrelated all words towards the response of a question, that is word salad. The next one is a tumor marker for breast cancer. Options are CEA, CA125, CA15, 3, all of the above. The right one is the all of above. So these are the most widely used tumor markers in the blood serum. What is the normal tumor marker level? Options are 2.5 Ng per ml, option B 3.8 Ng per ml, option C 20 Ng per ml, option D 20 Ng per ml. The right one is the less than 2.5 Ng per ml is the normal tumor marker. The next question is, which of the vaccine is contraindicated in pregnant women? Options are diphtheria, tetanus, hepatitis, and rubella. The right one is the rubella is highly contraindicated in the pregnant woman because it has the teratogenic effects on fetus. The next one is what is the meaning of aneurysm? Options are blood leakage, bulging of blood vessel, bypassing of blood vessel, occlusion in the artery. The right one is the bulging of blood vessel. That is nothing but aneurysm. So when the when the aneurysm is blast or ruptured, it can happen the bleeding. Mostly these aneurysms can happen in the brain. It leads to the stroke. The next one is what is applied psychology? Options are it deals about psychology of human. Option B, it deals about mind functioning. Option C, it deals about abnormal brain function. Option D, it deals about psychiatric conditions. The right one is a option D. Option D, it is a applied psychology is also known as deals about the psychiatric condition, abnormal psychology. The next one is a effect of adrenaline. Option A, increased heart rate. Option B, vasoconstriction. Option C, vasodilatation. Option D, both A and B. The right one is the option D. So adrenaline effect will be on the increased heart rate and cause for the vasoconstriction. The next one is what is the color of nitrogen cylinder in the hospital? Options are blue color, black color, yellow color, white and black color. The right one is the black color. So it is always black in the cylinder with the nitrogen gas. Identify the picture below showing. So here you can see an instrument we will use in the hospital setting. So what is the name of this instrument? Options are normal scissor, episiotomy scissor, artery forceps, hair cutter. The right one is a episiotomy scissor. So this instrument is called episiotomy scissor. The doctors made the episiotomy incision during the second stage of labor to expel the baby head from the vagina. The next one is identify the reflex in this picture. So here you can see the baby reflex. What is the name of this reflex? Options are Moro reflex, grasping reflex, tonic neck reflex, crawl reflex. The right one is a Moro reflex. The next one is identify the use of instrument in this picture. So here you can see the picture. What is the use of this instrument? Options are warmer, phototherapy, simple light, radiation therapy. The right one is a phototherapy. So phototherapy can be given for the babies to control the physiological jaundice. That is to reduce the um, bilirubin in the blood. The next one is which one of the early sign of increased intracranial pressure? Options are widening pulse, tachycardia, bradycardia, and increased blood pressure. The right one is the widening of pulse. So this is the main sign of increased intracranial pressure. The next one is an infant he is higher hypercyanotic spells. Okay, so when the infant is in the higher cyanotic spells, in which position we have to keep that child? Options are high phallus position, knee chest position, prone position, supine position. The right position is the knee chest position. So control the to hypercyanotic spells. This is nothing but sudden cyanosis of the body due to the reduced blood supply. The next one is which metal is used for the family planning? Options are iron, copper, silver, and aluminium. The right one is the copper. So copper, which it will kill the sperm cells. The next one is Mala D is an example of. It's a pill, injectable vaginal diaphragm tablet. The right one is it's a pill, Mala D. So it is coming with combined pills and a set of 28 pills, and it consists of ferrous fumarate and a start from the fifth day of menstrual cycle. The next question is which is the most effective method of contraception? So which is the most effective method of contraception? Options are condom, diaphragm, breastfeeding, oral pills. The right one is the oral pills is the most effective method of contraception. The next one is postcoital contraception is recommended within. Options are 6 hours, 1 day, 72 hours, and 3 days. The right one is a 72 hours. So has when the woman is in the risk of coitus, so she has to take the postcoital contraception method. She has to use that postcoital contraception method within 72 hours. So this is a levonorgestrel 0.7 mg. The tablets are available in the market. So the next question is, this is the last question. Which of the following is not a natural method of contraception? Options are interrupted coitus, IUD, safe period, abstinence. The right one is the IUD. So IUD is not a natural method of contraception.